think we're live.
Yeah, we're live.
Okay. Good morning, everybody. We're here again today to talk with you about what communication concerns you may have with your children at home, your children with autism and ADHD, because we hear from parents all the time about the concerns they're having about how difficult it is to communicate with with their kids,
Mm-hmm.
to interact with them appropriately, to strengthen the bond with them. And so we just wanted to come on here and share some thoughts and just some solutions that we found in our practice that works. And so if you don't know who I am, I'm Dr. Hoke Eko, founder of Glow Pediatrics, and I have the amazing Dr. Amara with me, who is our, tell us who you are.
So, hi everyone, I'm Dr. Mara. I am a holistic health and nutrition coach for children and families. I am also an ABA parent coach. I am a doctor of educational psychology with emphasis on applied behavior analysis and autism spectrum disorders. So today we just wanted to talk about communication challenges at home and how you can improve them. So if you have a child currently attending therapy, currently going through ABA speech or occupational therapy, we understand that from the experience and from the cases we listen to at our practice, it is possible that your child can be making progress, at the clinic or during therapy and not making progress at home. And that's why today we just want to talk about how you can improve communication at home. When the child goes in for therapy, there is the environment is arranged to ensure that communication is improved. So if your child is struggling with requesting, they set up the environment to stimulate that behavior. If your child is struggling with potty training, there is the environment is set up to address that behavior. But the question here is, how can we you know set up the home in such a way that that communication that is established during therapy is generalized into the home setting? And that is where we come in to see that, to ensure that whether you're a homeschooling mom or your child goes to therapy or your child goes to a public school, there is a need for you to practice communication at home. And one of the things you could do is to identify what goal do you have. Now, as repetitive as that sounds, or as easy as it sounds, it is very crucial. Now, you want to be able to ask yourself, for my child with autism, or even for my child with ADHD, what is my goal? What do I want to achieve? Now, there are children I have had, I've, worked with over 200 parents of children with autism, and I would see, the parents always tell me during our sessions that, when this child goes to school or when he's in therapy, he's able to point for a child that is nonverbal, they are able to point, use the speech devices while at therapy. But when they come home, if they want the same item, let's say, for example, the child wants yogurt, our therapy is able to point and the therapist will give him yogurt. But at home, he will roll on the floor or drag mom's hand, or and there is this mistake I see parents make. Being a mom myself, you understand what your child needs even before they say it, right? And that is a trap, because when we provide things based on our understanding of their behavior, we are limiting communication. So I going back to my major topic is, you need to identify your goal. So in our program, we have different communication goals that you can focus on. So, for example, requesting for needs and wants is a major goal that every parent must have. If your child is not able to communicate based, now for children with autism, that is one of the major deficiencies they have in communication, where they're not able to tell you. Parents always say, I don't know what he wants. I'm not able to, identify his needs. So that is one of the basic skills we want to, teach every parent of children with autism, how to, teach your child to communicate their needs and wants. That is basic. And then we have the next level, which is exchanging information, then being able to tell you how they feel, what they like, their thoughts, their opinions. That is next level. And then we have the other level where we want to, increase conversation turns, have them, talk in an open-ended format, have them, critically think and solve problems. That's a higher level. So I've talked about, I've just spoken about three levels of communication, and I want you as a parent to begin to think, what level is my child? Is my child able to say, I want this? And this is regardless of if your child is verbal or nonverbal. If your child is nonverbal, we can train them either through the PEC system, the picture exchange communication system, or we can train them through, using an AAC device and an augmentative, system to assist them to speak. Or we can also teach them gestures, how to point. But even if your child is nonverbal, there are different multimodal methods of communication that they could learn. So wherever you are, one of our short things, our assignment for you today, if that's what we should be, is identify, not based on what the therapist is saying, not based on what the BCBA or what the speech therapist or what the OT is saying, based on your experience at home. I want you to evaluate, is my child able to request for needs and wants? Now, if the answer is yes, how often? Is it only when they desperately need something? Or like, can you beat your hand? Like, can you, can you, comfortably say that if my child needs yogurt, he will tell me he wants yogurt. If he needs water, he would. Like, without me, guessing and wondering and predicting, I'm able to tell. So that's the basic level, because we want them to be able to communicate needs and want. Now, if your answer is no, then you need to identify the goal and start working on it, right? That is where the ABA strategies come in, where we need to start, providing lots of trainings, creating the right environment, employing some strategies to help that child. Meet that behavior of requesting. Now, if your answer is yes, my child is able to say, I want this or I want that. The next thing is, we will need to move to the next level. Is your child able to respond to questions? Now, if you ask the child, do you like this? Now, I want this is different from, oh, I like this, or this is what this is. So I can say, I want apples. But when you give me between apple and strawberries, am I able to tell you what I like? Am I able to tell you, oh, I think this one looks smaller than this one? Am I able to express my feelings? Oh, apples, we get them at HEB, for example, if you're in Texas, right? So you want to ask, is your child able to exchange basic information, basic communication skills? Like, what do you like? Where is she? What is she doing? What is this? Who is that? Basic, response to questions. And if the answer is no, then that should be your goal. And talking about a goal, if you are looking for an individualized parent coaching program, we have one where we would walk you through this, evaluate you, assess you and your child. We There is an assessment for parents where we assess the parents readiness, so you can be assessed, and your child's communication at home can be assessed. We can help you create a goal and walk you through it in 6 to 8 weeks, and at the end of that, you should first of all learn how to turn your home into a communicative environment. I usually tell all my parents that your home can become a communicative. I have a son who is a toddler, not on the spectrum, but it's still the same thing. When you're teaching toddlers to talk, it's almost the same format. You have to turn your environment into a communicative environment. And it's not anything complex. Like, I was speaking to a parent yesterday who has a 4-year-old son with autism, and she was just sharing most of the activities. They recently did a pretend play where he was mom was washing her car, and he was washing his own car and he was pretending that he was doing a drive-through. So she said that she realized that when she creates those communicative opportunities, he's able to express himself more. So I just wanted to say that it doesn't have to be anything complex. You can use what you have at home, the activities you have at home, the routines you have at home, but all the difference there is you need to turn it into an opportunity for your child to communicate. Like the mom yesterday who rounded up our program said that one of the things she learned from from the parent coaching program was that it opened her eyes to things she would normally do every day. She began to do them differently, and to me that was really very satisfying for me to hear that the same thing you're doing, but you would be amazed at how powerful they are, how effective they can be when you turn them around intentionally to improve communication. So I think that's what's possible. So if you have a child who is nonverbal, you need to get on our program. If you have a child who is verbal but struggles to communicate their needs, struggles to communicate their wants, struggles to respond to question, or you find they are just being repetitive. When you tell them how are you, they say how are you. When you tell them do you want milk, they say do you want milk. If they are echoic, repeating what you're saying, you need to get on our program. If they are struggling with mind like requesting, you need to get on our program. If you want to advance, improve their communication to an advanced level, like for some children with autism, they're not able to differentiate between what, who, where, why, and how, and that's something we can help you train them. So Dr. Kaino, I'm sorry, I know I went ahead of myself, but please go ahead and ask and let me know if there is any other yeah, so but just to wrap up, right, from my own session, one of the major things I want you to do as an assignment, and maybe you can DM us and let us know if you did that, is what stage or like evaluate your child's communication. Are they able to, request for needs and wants? Are they able to engage in, response to basic questions like exchanging information? Are they able to, critically think, and answer questions relating to problem solving, like, oh, why is this going on? And they are able to tell you, I think it's because this is happening. If when you identify the stage your child is, you can just DM us and let us know, I think this is what we're struggling, and we could let you know if our program is right for you. Okay.
Wonderful. Wow. Thank you, Dr. Amara. Yes, you are the expert, so I let you talk. So, so parents, I hope you heard everything she said, and please share this, of course, with whoever is in your world that you know needs to hear this, because it is possible. There is hope. Our children with autism
Yeah.
and ADHD can learn to communicate better their wants, their needs, so that they can thrive better in the environment they are in, right? And especially for we parents, right? It's important to know that your child isn't stuck. Your child can improve. There is a way to do it. And yes, is it a process? Absolutely. Is there a magic pill? No, there isn't.
No.
Is it possible to improve? Yes, again, it is possible. So, but you just need to be willing to put in the practice. And we're not trying to make you into an ABA therapist, not at all. We want to empower you, the parent, in your own home environment to set up your home, like you said, Dr. Amara, as a communicative place, right? And where your child can just, I don't want to use the word diffuse, infuse, but they can just being in that environment just improves their communication, and that's what we want every parent to experience with who has a child with autism and with ADHD. And a lot of times people don't think ABA, we only talk about it for autism, but absolutely it does help for children with ADHD to communicate better, because there is that need there as well. And so reach out to us. Would love to hear where the assignment she gave you, which is where is your child? What goals do you have for your child? Where is your child on the communicative ladder? And what would you like to see improve for you and your child at home? And yes, we're here, happy to serve. We have a cohort starting. We're looking for 10 families, and we want to just walk alongside you in a personalized manner, one-on-one care, so that you can get the best care for your child. And here at Glow Pediatrics, we believe in serving children, mind, body, spirit, and the parents, right? We call ourselves like adult doctors at this point. Even though
Yeah.
we're not for the child, we're also for the parents because it's the whole family, right, that we want to improve things for.
Yeah.
So yeah,
Yeah, and Dr. Echo, do you want us to just talk through what our program looks like? And
sure.
okay, so if you join the program, the first thing that happens, so just going from the assignment I gave, let's imagine that you identify that your child, for example, is not able to request, they're not able to communicate their needs and want. That could be your one major goal. And bear in mind that one of the things I have seen over the years, I think in about 7 years of doing this, is that when you train on one side, there are chances that what the training could reflect in other areas. So why it is that you're teaching your child to be able to request for their needs, it's possible they could be able to do that outside of the house or with someone else. But going back to what I was saying, the moment you're able to identify what that goal is, what we do in the program is in the first is a 12-week program. So in the first and the second week, we meet with you to understand. So based on that goal you have set, I would have you, observe your child for like a week. And it's a practical program. You're going to be working every week. So you would have a child observation from where you just act as a mom therapist, to kind of observe your child to know, okay, what exactly, where are the deficiencies, what is the problem, and we will walk you through that. And in the second week, based on the interview, the observations, we will come up with a comprehensive, practicable, home-based intervention plan. So when your child goes to, remember, IEP is used in school. Now imagine you having your own IEP designed for your home, designed for your child, based on what goes on in your home. And every week, bi-weekly, sorry, we would work. So we would have goals every week, every 2 weeks. So let's say our goal this week will be to ensure that for example, if it's for requesting, an example of a goal could be that across breakfast, lunch, dinner, we want to train the child to be able to request without aggression, without tantrums, without dragging mom's hand to the fridge and like, hey, give it to me. But we want you, regardless of if the child is verbal or non-verbal, and we will walk you through those goals. And get ready, is a practical training program, so you would send videos of what you're doing so that we can provide feedback. And we would also have a group session where you meet with other parents to share ideas. And so that would go on for about 8 weeks, and on the ninth week we would evaluate your progress, see where you are, and then allow you begin to set goals yourself. So we train you to the point where, number one, you're able to understand what you should do at home to help your child communicate, how to prompt properly, how to model, how to use errorless learning the right way, how to generalize those skills your child has learned at home to other environments. And a good example of this is, I was working with a mom. We are teaching the child to request for food and basic needs. And when he learned the skill, mom did a drive through at Chick-fil-A, and he was able to request, he was able to order for his favorite meal, at the drive through. So we could do that. Now the same thing happened with a recent parent I concluded with. I worked with mom on responding to questions, making choices, and he was able to shop at the grocery store. Like, mom took him to HEB, and he was able to point and say, oh, I want this, let's shop for this. And that was amazing. So we would walk you through that process and teach you how to implement these strategies in the comfort of your home. So by the end of 12 weeks, I am very sure that, number one, you will understand what communication is in the confines of your home. It's not just, oh, he is improving, but you don't have a personal testimony to that, right? So that is what we're going to teach you, and you would learn how to set up your home to be able to improve your child's communication. So we look forward to seeing you at our program. Okay.
Okay, wonderful. Yes, so that's it. Come on over. We're here to serve you and your entire
Okay.
family.
Okay. Thank you.
And for those watching on YouTube, I think there's a link in the
Description.
description box, and for people watching on Facebook, we'll have a link there as well. So Looking forward to having you. So
Yes,
take care
yes.
and please share
Okay.
this with whoever needs to hear this. Have a wonderful day.
Bye.
Bye.